Hello, everyone. I'm Elle Brayton. I'm the Director of Marketing at Beckett, and I will be moderating today's presentation. A couple housekeeping items real quick as we get started. This session will be recorded. So I'm going to send the recording at the end of the session along with contact details for the presenters and links to additional information. If you have any questions at all, you can enter them in the chat section by clicking the chat button at the bottom of your screen. Questions will be answered collectively at the end of the presentation. Let's get started. Welcome to today's webinar, Getting Started with the Theon Care Management Package by Geneia. Today, you're going to learn all about what the Theon Care Management Package is and how it can support healthcare workers on the front lines to efficiently field questions and triage the overwhelming influx of patients coming in as a result of this pandemic. So let's get started with a quick introduction of our panelists. Today, we're joined by Lori Logan, the Chief Product and Client Officer at Geneia. We have Josh LaQuire, the Chief Operations Officer at the Coterie, and David Lott, the Director of Customer Success at Beckett. Without further ado, we're going to kick off with Lori. She's going to introduce the Theon Care Management Package. Lori?
The COVID-19 solution is an extension of our existing Theon platform for care management solution. What we found and knew is that as the news of the pandemic grew at such an alarming rate, we knew that there was a way we could help. The call volume that was coming into practices and hospitals was through the roof, and the number one stressor is patient questions. With how can they get education? How do they know what to do next? Do they need to see a doctor? Do they need to talk to a nurse? Do they need to just read some information and put them at ease? So a very, very high, stress zone in that. So what we did and what Josh just showed you is really come up with a solution that was specific to intaking those call scripts based on the CDC guidance, which was changing, daily, and then really be able to triage the patient along to see if they needed to meet with a nurse, was there follow-up that had to happen, and to really ease that burden. And if you think about the requirements of it, it's really supporting a high volume of calls for existing patients, but also new patients. So especially in the hospital scenario, they're calling their community hospital, maybe not their physician. What the providers are dealing with is how do they, in this high volume area and high stress area, how do they most effectively use their resources at the practice and preserve their higher level clinical teams to really deal with the patients that need them? It had to be very rapid install. So normally in healthcare enterprise software where we play, it's a 6 to 12 months, sales cycle. It's a 6 to 12 month implementation. And we needed something fundamentally different, something that could be installed in hours and that we could install on their behalf. And then lastly, the time to value had to be extremely quick from a high usability and the piece that you just saw today with Beckett on the training front to make sure that it could stand on its own. They didn't have time to call the help desk, the support desk to go through, chairside training and stuff. It just had to be super quick, super effective and helpful, with that. So that's where we led into this. And again, just a little bit more on the Theon platform for care management. It's things that we do today with our products. What we did was really tailor this for a very specific, crisis point for the COVID-19 new calls that were coming in. That's something, we as a nation and certainly us as a team had not experienced before. So I think I will leave it with that.
And with that, I'm going to pass the baton over to David Lott. He's the Director of Customer Success here at Beckett. He's going to talk a little bit about how Beckett partnered together with Geneia and the Coterie to really bring this solution to life.
Thanks, everybody. We're excited to be a part of this project and to have partnered with these teams for sure. When we were introduced to what Geneia was doing, we knew partnering to deliver the right training in a quick and efficient way was paramount. As Lori had mentioned, we wanted to get this stood up quickly and we wanted to get folks trained quickly. And we have the right tool for that because Beckett is a just-in-time contextual digital companion that delivers training and knowledge directly in applications and workflows, specifically in Salesforce and in Health Cloud. So with the Beckett Chrome extension, users can find information directly on fields in Salesforce and with them wherever they are in the Chrome browser, actually. So this puts the explanation, the process, and training in real time in their workflow, reducing the need for traditional systems training. So traditional classroom style training, traditional onboarding, all of that is eliminated with the ability to give folks what they need in their exact workflow. So being experts in the training and documentation space, we also realized we needed expertise in the health cloud space, which is where we partner with the Coterie. So with that, I'll turn it over to Josh to talk more about what we built together and how it all works in the application.
All right, can folks see a Google Slides presentation and hopefully hear me as well?
Yes, we can.
Excellent. All right, good deal. So we'll just go ahead and dive right in. I am Josh LeQuire. I represent the Coterie. We are a premier Salesforce partner in the healthcare and life sciences space. We have many consultants on our team who are involved with building the Health Cloud product itself from the very beginning, as well as we've led many partner academies, leadership academies to talk about Health Cloud. We are experts in the space and love the solution. So if you have any needs to take what you see today and expand it further and get deeper into Health Cloud, give us a call. Always happy to help. So let's talk a little bit first about what we're looking at inside of this package. What we have here is, as David and Lori mentioned, a quick start solution for folks looking to adopt technology to handle COVID-19 patient intakes. And in fact, we have some key people involved in this application. So we'll take a look a little bit first about how this works. And just a quick footnote to this, the Theon Care Management application is an application built on top of Health Cloud, which itself is built on top of Sales and Service Cloud inside of the Salesforce platform, which means you have a lot of capabilities to do pretty much anything you can imagine you might want to do from a perspective of handling patient information and data. But we'll focus specifically today on the Theon Care Management solution. So let's talk a little bit about who's involved and what they're doing. First and foremost, you have patients as our end constituent or end consumer, for lack of better words, who are calling into a clinic looking for help for potential COVID-19 symptoms and treatment. In the solution here for Theon Care Management, you have intake agents working who receive those calls, set up the patient record, start an assessment, and also log critical transactional information around what was discussed on a call, as well as send out patient information and have all that tracked. So if you think of Health Cloud and Theon as an extension of the CRM, very core information here, right? So you have a patient record, you have activities, all this is being documented in one central place for all to see and all to use. Triage nurses will eventually pick up these patients and assessments that have been entered in the system and complete the COVID-19 assessment with the goal of not only logging this information, but deciding the care plan and course of action to be taken and make sure that care is delivered in a timely manner. Last and certainly not least in the application, you have what's called a practice manager. And this individual operates in the capacity to manage quality, to manage flow, and make sure that patients are being handled in a very timely manner. The beauty of having all this information in a single platform is that a practice manager can report on activities, can report on progress, and ensure that patients are receiving quality care in a timely manner. So just to wrap this all together in a very simple end-to-end flow, you have a patient making a phone call to the clinic, you have an intake agent who's setting up the patient record and starting the COVID-19 assessment, logging the call and sending the patient information. You have a triage nurse eventually who receives an assignment with this patient who is called in to finish an assessment and log information, as well as decide the ultimate course of action that needs to be taken to deliver care to that patient. And in between all this, you have the practice manager overseeing these and ensuring that patients are being treated in a timely manner and quality metrics and performance is being monitored and flowing through smoothly. So let's go ahead and take a dive into the solution and see what it looks like. Can everybody see my screen okay? So far, so good. Okay. Good deal. Okay, so when you log into the Theon Care Management application, it exists like any application in Salesforce. You can access it here inside the application switcher to get the context for what you need to do specifically as an intake agent or triage nurse or practice manager. And in fact, when you log in as either of these individuals, you actually have a landing page that helps to frame what you need to do for your job. Since we've integrated Beckett into this solution, you have a lot of powerful capabilities at your fingertips to learn even further what you need to do once you log into the application. As you navigate through here, you'll see these little icons called specs that you can hover over, get some information. So here, even after you've conducted an initial training, even after you've gone long past the first setup, you can still access this at any time in context to get that help on demand, which is extremely powerful when you need to get a solution up and running quickly and ensure folks are doing their job correctly and properly. So you can put specs anywhere inside the application and make this super helpful for all folks involved to know what they're looking at quickly. So you can see here, for example, even if I've gone through a training and forgot, I'm reminded that, oh, an account is a patient, and this is a view of all accounts in the system. Likewise, you have a Chrome extension in your browser to where you can look at information not only in context, but you can find anything that there's information on inside the application. So here, topics are a way to group different things that I need to know. We have them grouped by persona, so you can see intake agents have their own topic. You can see practice managers as well as triage nurses have their own as well. And also by things that we work with, like patients and assessments inside of cases. So here I may, for example, log in as an intake agent. I may go ahead and set this view so that if I need to access it side by side while I'm working, I can click on things like all accounts. I can click expand, and voila, I've got my in context help right here. If I see things I like inside of the system, I can star them, and I can always go back to my starred items at any time and access anything I've starred in the past if I want to revisit it later. So a lot of great capabilities here to not only use this application as a quick start, but to get up and running quickly with folks in the field with minimal training needed and tons of in-context help to keep them going. So let's take a quick look at what these folks are doing inside of this quick start package for Health Cloud. So in Theon, I will typically receive a phone call and first look inside of Salesforce to see if this patient exists, or create the new patient through clicking this new button and filling out a quick form. So I might do something like this where I say Tom Hanks. We'll say Tom was born on May 1st, we'll say 1961. We'll fill out the required fields. You can see within seconds, so here put in his county is Los Angeles. I've created a patient record, and this is really the core of everything you need to do inside of Theon Care Management as well as Health Cloud. And in some cases, if I am unsure of what to do next, I can always access Beckett and the specs here on the right to go and find what I need. So for example, I don't see a spec right next to this patient intake, but if I go inside of Beckett and see what I've started in the past, I can say, oh, here's my patient intake assessment spec, and here's how I can follow these instructions. So very easy to use this tool, very easy to customize this tool as well if you have needs to further customize this and make this more of your own. That being said, as we expand this application out, conducting assessments is as simple as clicking next and going through the prompts. And the beauty of this is well scripted out for any intake agent to take on, so there's no ambiguity about what to say or what to ask. Very clear, cut and dry questions about what he or she may ask a patient on the phone. So here we'll just go ahead and click yes through these initial prompts. And as we navigate through this, you'll even see that some of the answers and some of the options change as I choose particular answers to specific questions. So lots of great dynamic capabilities here based upon your answers to route people to answer other questions or to route people to different types of tasks and duties. So this in and of itself is built upon a great piece of Salesforce called Flows that's very easy to configure. When you work with a partner like us here at the Coterie, we can also go in and customize these things, further expand these things, add fields, and do all that kind of stuff as well. So all this stuff here you see, you can certainly tailor to your needs. Very easy to do and very quick to deploy. As an agent as well, not only can I complete these questions and either start the triage and finish it or put the patient on hold for one of the nurses. Let me just go ahead and click next and click finish. I can log my phone calls. So here I may say, for example, this was an intake call. Oop. It's always hard to spell when people are watching you type. And I can add comments. Salesforce does provide these great capabilities, things like quick text, where, you know, if I had scripted text that I wanted to just pop in here or code really quickly, but I can here, for example, say, you know, gather initial assessment. handed off to triage, and very quickly and easily save that information so you have a complete picture of all activity around this patient. And this is just really fantastic for folks because anyone can go in the system at any time and see what has happened in the past, what is coming up in the future. Likewise, I can send templated emails, and this is a nice part of the solution as well. So after we speak with this patient, if we want to send, for example, a COVID-19 triage follow-up, we can fill out the template here and send this out. And likewise, we can go in and access assessment information here in cases. So the intake agent experience is very straightforward, very cut and dry. The idea here is let's get the patient in the system, let's start the assessment, and let's hand it off to triage. And if I flip over here to the triage nurse's view, likewise, I have some helpful information here at a glance that will help me do my job very effectively. So for example, I can see these patients who are sitting in the queue waiting to be served. I can see, for example, who's waiting on hold. We'll see here we have a couple patients waiting on hold. So I have great capabilities if someone is not assigning me something, if I need to go pick up something from a queue, I can go straight to this. I can click on the case. I can accept an assignment, which indicates that I'm now working this assignment, so nobody else will actually go in and work it. And I can complete the assessment. So just like we saw before, we have an intake assessment here. Again, if you want to use Beckett to help you find these things, very quick and easy to go inside of Beckett, type in your search, find what you need to do, expand this over to the side, have Beckett up side by side as we complete the assessment. The beauty of this solution, again, is as we go through and we complete this assessment and gather this information, all of this is stored here conveniently on this case record for this patient, which means it's available for reporting, it's available for analytics, it's available for tracking. So anybody can log in at any time and see this information. The other key persona that's part of this application for this quick start is the practice manager. He or she has a lot of very critical pieces of information at his or her fingertips to monitor. For example, we can construct reports and analytics of things like the count of patients by county that we've been treating. We can see the distribution of ages for our patient population. All this is customizable. We can certainly put these things into groups if we don't want to see it year by year, and so forth. So the data exists in Salesforce. Salesforce is a very open platform, very easy platform to build these types of reports and charts, but you can see here a couple out of the box that should help you get up and running. I can see all the work that my team is doing in terms of assessments. I can see all the activities my team is doing here. As tasked with monitoring quality and flow, I can see things that are overdue, ensure they've been followed up. I can find things in the system that are getting lost and push them through. Great capability to play air traffic control here. All right, so I'll hop quickly over back to the presentation so we can hand it over to some other folks to continue their pieces. Now that we've taken a look at the application itself, where do we go next? Because Theon Care Management is built on Health Cloud, which is built on Sales and Service Cloud and Salesforce, there are infinite capabilities to how you can use this as a total all-in-one integrated solution to manage your healthcare practice. You can enrich Health Cloud data with data from your EHR so that folks outside the clinic, depending upon their security and their access, can access that information as needed to do their jobs. You can use tools like Theon and Geneia to analyze your population health data, find care gaps, and find opportunities for more proactive programmatic care. This is the real power of the platform. You can use automated email, text, social, and ads to provide that proactive engagement for your patient population so folks can come into the office, be seen, and become aware of resources that exist. You can publish content on the sites. You can do a whole lot. You can model relationships. You can open up access to coordinate care across practices, providers, home health teams, and many other types of constituents to manage your patients at a very personalized level. So the Health Cloud platform, as built on the wonderful Salesforce platform, is highly extensible, highly flexible, highly customizable. And again, we at the Coterie are here to help. So if there's anything we can do to help you further build out this solution, if you have any questions about what it can and can't do, and you want to take a look, please give us a call.
So just a quick recap for everybody here. For the COVID-19 solution, you can access Health Cloud, the Theon platform for care management, the training, and the Beckett platform, all 100% free up until September 30th. So what we're going to be doing after this call is sharing contact details, a copy of the recording so you get the demo, and we have teams ready to assist with any questions along with supporting you through implementation and onboarding support. So please do not hesitate to reach out. Again, you'll have contact details for all of the panelists. We're here ready and willing to help. This is a solution that you can be set up in, as Lori mentioned, in a matter of hours, not weeks, not months. So the goal here is to get you up and running as quickly as possible. Thank you very, very much. And I hope to speak to you all soon.